Welcome to the pre-retirement seminar for instructional staff. Instructional staff includes HEOs and ECPs and classified managerial to some extent. Today I am accompanied by my colleagues Jenna Maynard-Pilgrim and Delfino Rojas, who are going to take over some of the presentation. This is the agenda of topics that we are going to go over. I ask that you keep your questions to be general in nature. We don't want to get into personal circumstances and nuances about how to apply these policies. If you have questions, keep them general. If you have specific questions about your own circumstances, feel free to email me offline. Your first point of contact really should always be the benefits officer at your campus. But I am here to assist and provide guidance when needed. So these are the topics we're going to go over today. This is language that's taken from your contract, and it dictates the criteria for eligibility for retiree health benefits for TIAA members. And I chose this particular passage because it is for employees appointed on or after September 1, 1985, and I suspect that most of you on this call fall into this category. So retiree health benefits is one of the most valuable benefits we get as CUNY retirees. Everyone knows the high cost of health insurance. The retiree health plan that CUNY offers its retirees is coordinated with Medicare and becomes a very valuable a commodity in your retirement. So if you are in TIAA and you separate, you retire at the age of 62 with 15 years of continuous full-time pensionable service, you will be eligible for retiree health for life for you and your spouse. If you are separated prior to age 62, but have 15 years of continuous full-time service, you can come back when you reach age 62 and request your retiree health benefits. However, there's a caveat, and that is that if you leave CUNY with 15 years of service and you go to work at another higher ed institution in the same capacity that you worked at CUNY, you will not qualify for retiree health. So there is that caveat. So where you work after you leave CUNY with 15 years service matters when it comes to retiree health. For TRS, NYSERS, and Board of Ed retirees, you have to have 10 years of credited service for retiree health. You have to have worked 20 hours or more a week in an eligible title, and you have to receive a pension check from TRS, NYSERS, or Board of Ed. This is a recommended retiree timeline. Verification of service is very important because your service dates dictate. Please mute yourself. Your service date dictates what you're eligible for, when you are eligible for it. And so verification of service is important because sometimes your understanding of when you started working at CUNY is different from what your records show. And also the service that is reported to the pension systems. And an example of that is very often faculty come to CUNY as adjuncts, and adjunct work is not credited towards your 15 years or pension eligibility. Because sometimes you come as adjuncts and then you're appointed after the fact to a full-time teaching position. And that is the point at which you join a pension system. You can buy back that time as an adjunct, but your membership date is based on your full-time appointment And that is what triggers everything else. Phased retirement. So the reason why I bring that up is because that is something that you should talk about with your campus benefits or HR office to make sure that your understanding of your hire date or your membership date with a pension system is consistent with the records that the campus has for you. Phased retirement is another benefit that you have that we're going to get into. Phased retirement is something you should apply for 4 years prior to your expected retirement date. Phasing can be taken in 1 year increments up to 3 years, and that is why, and you have to apply for it about a year in advance, and that's why we say phased retirement is something you should take care of 4 years prior to retirement. Travia leave, 4 months prior to the start date of Travia leave, you should contact your pension system, have a conversation with them, get advice from them, make sure that your dates of service in their records is consistent with your understanding of it. You can also contact Sandra Zaccanetta at the PSC Welfare Fund. She takes appointments and does pension consulting, so she's a resource for you as well. Medicare Part A and B, we're going to get into in detail. You should apply up to within 3 months of turning 65. That is for Part A. For Part B, you don't do that until you're actually retired. We'll get into that. And then 2 months before you plan to retire, you should, or as early as it's as practicable, you should contact your HR office, get all the documents that you need. They will have a retiree package for you, all the pertinent documents. You will fill them out, send them back to them, and they will distribute them to all the different agencies and entities that need to get those forms. And then finally, if you are participating in any of the NYSIT plans, you should contact NYSIT if you want to continue participating in those insurance plans into retirement. One of the requirements is that you have to be a dues-paying retiree union member in order to keep your NYSIT plans, but you should contact them about what the payment plan will be, the payment arrangement will be once you are no longer receiving a paycheck. So how do we pay for retiree health? For TRS members, premiums are deducted from your monthly pension check. For TIAA participants, there is a requirement, and it's mandatory and it's non-negotiable, that if you have 15 years and you are eligible for retiree health, you have to reserve $50,000 in your TIAA account. It doesn't mean that it's taken away from you. It sits in your account, it accrues interest. It's just frozen. You can't withdraw the 50,000 because it is there for you to ensure that you will never risk losing your health insurance because a payment wasn't made, a premium payment was not made. And so in order for your premiums to be paid by your annuity, you have to annuitize a minimum of $10,000. So that's 10,000 of the 50,000. Once you annuitize 10,000, you still have to reserve the remaining 40,000 in your account. When establishing a lifetime annuity, you have to ensure that the amount of your annuity is enough to cover your health insurance premium. So most retirees are in the senior care plan, and the senior care plan, if you have the rider that I highly recommend you getting, it's $3 and change for just you, and it's about $7 and change if it's you and a spouse. So the $10,000 annuity will more than cover those premiums. But if you're in one of the plans where the premiums higher than that, you may have to annuitize more than just $10,000. And that's a conversation you'll have with TIAA. You will tell them which plan you're going to be in and how much the cost of that plan is per month. And they'll advise you about how much you need to annuitize in order to cover that premium so that you never have to worry that a payment is made, because those annuities are paid to you for life. Verification of service, as I mentioned earlier, is important because sometimes you may have worked at multiple campuses. You should make sure that all of that service has been reported. Sometimes there's a lag in the service that's reported to TRS. Sometimes the service is reported, but there's a lag in the time that it takes TRS to update your records. So these are all things that you should talk about, verify, make sure that all of your service at all your campuses is being credited, and so that you don't this is not something that you should do at the last minute. You should do it ahead of time. Also, we're going to have a speaker from Social Security Administration, but it also is important to note that Social Security Administration is also your Social Security work history also should be verified. You should create an account on the Social Security Administration website. You should look at all the years of service that they've credited you for, and you should make sure that it's all there. Sometimes we worked at part-time jobs when we were teenagers or interns or internships. If those were W-2 wages, then they should be reflected in your Social Security history. And this is the time for you to make sure that all that history is accounted for. Phased retirement is a program that allows faculty to phase into retirement by working a shorter workload with a 50% workload with a reduction to a 50% salary for 1, 2, or 3 years. And what it does is it allows you to gradually phase into retirement without a cold turkey ending of your careers. This is only available to TIAA participants, and to be eligible, you have to have reached age 65 and you have to have had 15 years or more of full-time continuous service by the start of the phasing period. As I said, your workload is reduced to 50%. Your salary is reduced to 50%. For faculty, you have to begin phasing on the first day of the fall semester. And then you will be at 50% workload for 3 years. A caveat to that is that if you are going to take Travia leave, which I'm going to talk about in a second, if you're going to take Travia leave, you can take Travia in the final semester of your phasing period. So during your phasing, you're receiving 50% salary. And then when you're in that final semester of Travia leave, your salary reverts back up to 100%. And then you'll finish out that spring semester. Spring is usually the time that people take Travia, and then you'll have annual leave over the summer after that, and then your retirement date will be the last day before the fall semester. As I said, it's only available to those who participate in the TIAA optional retirement program. The decision to phase is irrevocable. So once you begin the phasing period, you cannot change your mind and decide to come back to work after phasing. Once you begin phasing, you have to retire at the end of the phasing period. And even if you are taking Travia leave in the final semester of your phasing period, because generally, very often people come back after Travia because Travia allows you to rescind your decision to retire. But if Travia is part of the last semester of your phasing period, then that becomes irrevocable also. You should apply for phase retirement a year before you plan on beginning the phasing period. For HEO titles, phasing is slightly different. The workload is reduced to 80%, the salary is reduced to 80%. You can phase in 6-month increments, so either 6 months or a year. It doesn't have to necessarily start with the fall semester because unless you're tenured CLT, because HEO titles are not always tied to academic appointments. And also, again, you may elect to take Travia at the end of your phasing period. So now I will let Jenna take over and tell you what Travia leave is.
Good morning. So Travia leave is eligible for instructional staff. 1/2 of your accumulated unused sick leave up to a maximum of 1 semester. It does not count against your Social Security. If you have a maximum of 160 days, the Travia is up to 5 months. For spring Travia, request the form from HR in November. For fall Travia, request the form from HR in March. Note, participation in the dedicated sick leave or catastrophic sick leave bank programs may adversely impact your Travia leave benefit. Review transit benefit enrollment and consider adjusting contributions based on commuting needs. Pre-tax balances are forfeited. So, and this is the eligibility by tier for the Travia. So you can see the years of credited services. I won't go through each detail of this, but you can see for yourself which tier you're in and the years of credited services and the age you need to be eligible for the Travia. So Travia and your annual leave. Faculty who take Travia leave in the spring semester will be paid out their unused annual leave during the summer immediately after Travia leave ends. Faculty who take Travia leave in the fall and retire immediately prior to the spring semester will forego annual leave during the summer after the end of Travia. HEOs who take Travia leave will have their unused annual leave paid out at the end of Travia, subject to policy limits. So for the annual and fellowship leave, the annual leave cap, accruals above the cap will not be paid without prior approval. Annual leave accruals above the cap, we recommend that you utilize as much as possible prior to your retirement date. So for ECPs, the cap is 50 days. For HEOs, the cap is 45 days. Fellowship leave for faculty members who were on fellowship leave during the spring or fall have to fulfill 1-year commitment of service after returning from the leave. Travia counts towards this service following a paid academic leave.
I just want to add one thing. I want to clarify one thing. The cap for the ECPs and HEOs of 50 days and 45 days, those pertain to lump sum payouts. So sometimes the campuses let ECPs and HEOs spend down their unused annual leave, but these are the caps if you receive it in a lump sum payment.
This is your favorite part, Talene.
Okay, my favorite topic. How do you coordinate Medicare with retiree health? This is one of the most confusing parts of retiree health coordination and really elicits the most amount of questions. So I'm going to stop sharing this screen and move over to the Medicare grid that I sent to everyone. Okay, so this Medicare grid helps you to navigate all the moving parts and all the different steps that you have to take at different stages of your retirement and active work. So let's just do an easy one. The very first line pertains to active employees. So if you're an active employee under age 65, you remain enrolled in the city health plan. Medicare Part A and B are not applicable because you're under age 65 and not yet eligible. If you're an active employee and you're over age 65, again, you remain enrolled in your city health plan because as long as you are actively working, even if you turn 65, you are not required to enroll in Medicare Part B. You can enroll in Medicare Part A within 3 months of turning 65. There's no cost to that, and there's no downside to that. But Medicare Part B is a plan that you pay for. Currently, it's about $200 a month. And so as long as you're actively working, you do not enroll in Medicare Part B. So that's an easy one. So let's see what a spouse does. If you are the spouse of an active employee, that's a second line down. If the spouse is under age 65, you remain enrolled in a city health plan and you do not enroll in Part A and B because you're not yet eligible. If you're the spouse of an active employee and you're over age 65, again, you remain in the city health plan. You can enroll in Part A when you turn 65, but you do not have to enroll in Part B because you are covered under your spouse's health plan who is an active CUNY employee. So the third one is slightly different, domestic partner of an active employee. If you're under age 65, the same rules apply, but once a domestic partner turns 65, they are not protected because the federal government doesn't recognize domestic partnerships. So even if the CUNY employee is still working, the domestic partner must enroll in Part A and B when they turn 65. They do not have that protection that married couples have with regard to enrolling or being exempt from any penalties for late enrollments. So I'm going to go down a little bit and do one that's a little more complicated. For retirees, this part of the chart pertains to retirees. So if you're a retiree, the first line, and you're under age 65, you're still enrolled in an active city health plan because as long as you're working, you're because you're under 65, you remain in the city health plan because you're not yet eligible for Part A and B. And so there's no coordination that's happening. You're still in the city health plan as if you're an active employee. But once the retiree is over 65, now a lot of things come into play. Now you have to be enrolled in a senior care plan, which is a health plan that is coordinated behind the scenes with Medicare, such that Medicare becomes your primary coverage and your senior care plan becomes your secondary. So behind the scenes, those are being coordinated. You must enroll in Part A and B within 3 months of retirement or 3 months of turning age 65, whichever comes later. The effective date of Part B should be the first day of the month in which you retire or turn age 65. So that means that if you are retiring on August 25th, you should enroll in Medicare effective August 1. Medicare Part D is the drug plan for Medicare. Because you are PSC Welfare Fund members, and you will get your drug plan, your retiree drug plan from the PSC Welfare Fund. You do not apply for Part D. Also, I want to stress, when you're close to age 65, you're going to be inundated with mail about Medicare Advantage plans. You can throw all of those in the garbage. You do not need them because your retiree health plan coordinated with Medicare is going to give you nearly 100% coverage, and you do not need to purchase a Medicare Advantage plan or Medicare Part D. And finally, you will apply for Medicare Part B reimbursement because the cost of Medicare as a CUNY retiree is reimbursable to you. In addition, if you are subject to an IRMA premium, that is reimbursable to you as well. So this is the time that you would apply for Medicare Part B reimbursement, and we will get into that in a few slides. So this is basically all the things you need to do, and it tells you when to do it based on whether you're under age 65 or over age 65, and whether you're a retiree, the spouse of a retiree, the domestic partner of a retiree. This should be a one-stop shopping resource for you to answer most of your questions, even though I still get the questions. It's okay. I don't mind. So, because I know it's very complicated. All right, so I'm going to stop sharing the screen again and go back to the original. Okay, let's go back to this. So, again, just to reiterate, Medicare enrollment is you can do within 3 months of turning age 65, whether you're working or not. Medicare Part B, you enroll within 3 months of turning age 65 or retiring, whichever is later. The effective date should be the first month in which the event occurs, in which you either retire or turn age 65. And premiums for Medicare Part B will be deducted from your Social Security check if you are collecting Social Security. And if you are not collecting Social Security, you will be billed on a quarterly basis, and you'll be responsible for paying it until you start to receive Social Security. Medicare Part B reimbursement is managed by Delfino Rojas. You may already know his name, but if you don't, he's going to be your best friend when you retire. So Delfino, please talk to us about Medicare Part B.
Good morning, everyone. Thank you, Talene. So as part of your retiree benefits, you are eligible to receive reimbursement for the premium of your Medicare Part B plan. Uh, in order to receive this benefit, you must be enrolled in a city healthcare plan. If you decide to waive your plan at the time of retirement, you will not be eligible for Medicare Part B reimbursement. Uh, in order to apply for this benefit, you must submit a form either to the city or to our office, the University Benefits Office. With that application, you must include a copy of your Medicare card, and that Medicare card should include the Part B enrollment date. Many times I've seen retirees submit a card, but because their Part B isn't included, at the time of their first reimbursement, it doesn't get processed and they don't get reimbursed for their first year of retirement and enrollment in Medicare Part B. The schedule of this reimbursement is very simple. If you retire this year and you also enroll in Medicare Part B this year, you would be receiving your first reimbursement in April of 2027. All reimbursements are issued in April for the prior year. So regardless of when you retire, what counts is the calendar year. And of course, when you enroll in Medicare Part B. Uh, you only have to apply your first year, and every year after, you will get your reimbursement every April for the prior calendar year. And this is known as the standard reimbursement because the city is reimbursing you for the premium that everyone who is on Medicare Part B is paying. So the standard premium. There is an additional premium that some people pay because their income is higher and over a certain threshold. And this is known as the income related monthly adjustment amount. Uh, this is something that requires an application as well, but unlike the standard reimbursement, it is not automatic because it's dependent on your income. And because your income can fluctuate from year to year, the city always requires proof that you paid IRMA the prior year. Uh, this is something that you apply for with the city, not with us. It's not related to us, but we can always advise you on the steps, but it is not with us. You would find it on the city's Office of Labor Relations website. If you ever need help navigating any of those forms, you can always reach out to Talina or to me. Uh, Other than that, I believe we're pretty much covered here. Talina, I'll pass it on to you again. Thank you, everyone. Talene, I think you're muted.
Sorry,
No problem.
I do that all the time. Lisa, I believe before I move on, I'll let Lisa ask her question. Lisa, you can unmute yourself and ask.
Thank you. My only question is this specifically geared towards the staff, EOs, and PSC? Because I think this Medicare stuff in the beginning, that's probably generic and applies to everyone, right?
Yes, if you're talking about the Medicare enrollments and the reimbursements,
Yeah.
yes, that applies to all HEOs and ECPs as well as teaching staff.
Okay. And the rest of the seminar, it's more geared towards the staff and HEO and PSC folks. Is that right?
This is for PSC
Okay.
titles, yeah, and that, but
Okay,
that
great.
includes HEOs, yeah.
Okay, thank you.
Okay. Okay, the transit benefit. This is something you should look into. You should log into Eden Red, who administers it for the senior colleges. And look at, if you participate in the transit benefit, you should look at your balance, because a lot of employees accumulate excess funds in that account. And because this is a program that's governed by the IRS because of the pre-tax nature of it, when you leave CUNY, you only have 90 days to spend down whatever accumulated balance you have. At the end of 90 days from your termination date or your retirement date, those unused funds will be wiped out and you'll lose them. And there's no way to refund you that money. The only way to use it is to spend it on public transportation. So if you are during Travia leave, for example, maybe you're not going into the office as much, so you're or at all, or maybe you're not purchasing your monthly train pass, but because you're receiving a paycheck during Travia, those deductions continue. So you really need to look at your account and come up with a strategy to make sure that before those 90 days are up, you've spent it all so that you don't lose it. In addition, sometimes employees apply for a reduced fare. If they're senior citizens, they apply for a senior citizen discount for the MTA and other public transportation modes. So maybe you forgot to adjust the amount that's deducted from your check. So that it's really important that you look at that. And if you find that you have over accumulation there and you're not going to be able to spend it in time, you should go to the HR office and have them reduce your contribution down to $1, so that $1 is coming out. You're still participating in the program, but the funds are not accumulating, and that gives you the opportunity to spend it down. So, and the same rule applies to the healthcare FSA. You have a limited amount of time from your retirement date to use up these funds and get them reimbursed to you. So this is the time to look at this account, assess whether it's worth it for you to participate in it, or make sure that you're not over contributing to it so that you can effectively spend it down before it's too late. Because again, this is governed by the IRS because they're pre-tax funds. And if you don't use it at the end of the waiting period after retirement, you're going to lose whatever's accumulated there is going to get wiped out. And you don't want to lose money on this because that was not the point of participating in it. The New York State Deferred Compensation Plan, the only reason why I bring this up is because this is an additional investment opportunity for you to put away pre-tax earnings into a retirement account. And the beauty of this plan is that if you are participating in either the TRS, Tax Deferred Annuity TDA, or the TIAA TDA, and you're maxing out on that, you can also max out contributing to the New York State Deferred Comp Plan because the two amounts are not coordinated. And so this is an opportunity, even if you're only a year or two away from retirement, this is an opportunity for you to put away more pre-tax funds when you can. And then you can effectively double how much you're deferring. if you're already deferring to a TDA. So next week, I'm doing two presentations, two seminars on pension and retirement, and a representative from this plan will be participating. So if you're interested, you should definitely sign up for it, because the withdrawal rules slightly differ from the TDA. It doesn't work exactly the same way. So you should be educated about how the plan works so that you can maximize your savings. Retirement counseling is really important. There's so much information. You should contact Sandra Zaccanetta at the PSC Welfare Fund, or someone, a counselor at your pension, whatever pension fund you're in, pension system, and or TIAA, and gather as much information as you can. Again, next week during the pension and retirement, we will have a representative from TIAA talking about TIAA accounts, and also TRS representatives. So you should consider attending that as well. Working after retirement, CUNY employees are so ambitious that even when they retire, they still want to work. But there are some restrictions for working after retirement if you are in a public pension system and you're under age 65. There's an earnings limit of $35,000. So this only applies if you leave CUNY, retire from CUNY under age 65, and you want to go work for another New York City or New York State agency. You have an earnings cap of $35,000. If you're over age 65, this doesn't apply. And if you work in the private sector, it doesn't apply. It only applies to those who want to retire under age 65 and continue to work at a New York City or New York State agency. When your circumstances change, your beneficiaries change, your marital status changes, your address changes, your banking account changes. This is all information that you should keep all these different entities updated. We don't really talk to each other. We don't share data. So it is up to you to make sure that everybody has your new address. Very often with the Medicare Part B reimbursement, people move and then their checks are sent to the wrong place because they forget that the check is coming automatically every April. And so it's important to make sure that everybody has your most current address on file, and phone numbers, email addresses, and also beneficiaries, because marital statuses change in retirement. You get married, you get divorced, there are deaths that occur. And so all these things you should be cognizant of, and make sure that everyone is updated on your status, even after you leave CUNY. And this is just basically more of what I just said. So I'm going to stop sharing now, and we are going to take questions. No one has their hand raised, but there's a bunch of questions in the questions in the chat. I will respond to during the presentation by the PSC Welfare Fund, because it's hard for me to speak and answer questions at the same time. So I'll take questions if you want to raise your hand and then unmute yourself when I call on you. Let's see, Lorna, you can unmute yourself and ask your question. Lorna Thaxter Turner. Okay, I have to move on. Diane Machado.
Good morning.
Good morning.
Thanks for this. Now, this may be just, I have two basic questions. So how long do you have to have been working at CUNY before you're eligible for all of this?
So if you're in TIAA, it was in one of the early slides. It was
I missed
language
the
that was
first
taken.
15 minutes. Yeah.
Okay. Oh,
Yeah.
You missed that?
I missed
Okay.
15 minutes. I got
Oh, yeah, I'm
here
sorry.
a little
Okay.
bit. Yeah.
All right. So if you're in TIAA, all of these things hinge on whether you've reached age 62 and you have 15 years of continuous full-time creditable pensionable service. That is the short answer.
Okay.
If you're in TRS, it's based on your tier. However,
I'm not in that, so you don't have to.
Okay.
I'm in TIAA.
Okay.
I've been at CUNY 11 years. Some
Okay.
things I hear you need to be here for 15 years, and some things I hear you have to be here for 10 years.
So the 10 years pertains to mostly because what happened was a few years ago, they reduced the vesting period for TRS down to 5 years. But even if you worked 5 years with TRS, I mean, as a TRS member, and you have reached the necessary age to retire, the Office of Labor Relations, who provides all the different health plans that we have access to, requires 10 years of service. So that's when the 10 years comes into play. So even if you are eligible for a TRS or a NYSERS pension with only 5 years service, you still need 10 years for retiree health. But for TIAA participants, it's 15 years.
15. Okay, so all of this, if I don't make it to 15 years, does not apply to me.
It does not, unless you're an
Okay.
ECP.
ECP, I was about to say that to Lee.
What's
Right,
I
so
don't know what that
ECP
is.
is 10 years.
It's an executive level position, and they only need 10 years for retiree health.
That doesn't sound fair. Okay.
You know what? Executives give themselves preferential
Yeah.
treatment. We see
Right.
that all over. It's not just a CUNY.
Okay, so if I'm at 11 years now and I don't think I'm going to do 4 more, then no benefits will come to me.
Right.
Right. Okay.
Okay.
Thank you very much.
Okay. Caroline Mendez. Caroline Mendez.
Good morning, everyone. Okay, so can you hear me?
Yes.
Okay. So my question is a little different, but some of that stuff applied to me. I have 27 years of service and I am TRS, but also transferred over from NYSER. So I have that as well. I'm wondering what is the best age to retire, or does it make sense? My plan was, since this year I have 28 years, I was trying to at least wait into the 30 years. I turned 62 next month. So does it make sense to wait to the 30 years, or should I just start planning now?
I think that what you should do is, since you're a TRS member, there's a member portal and there's a pension estimator, and you should go on and estimate what your pension would be if you retired now versus if you waited till 30. And then when you see the difference, or you can contact TRS and talk to a representative, get advice from them so that you can make an educated decision. So is the increased amount at 30 years, is that justified? Do you still want to continue working? You know, maybe the difference is not that great between 27 and 30, and that's a personal decision that you have to make. But you should take advantage of the member portal and the calculator and do some math and see what makes sense for you.
Okay, thank you so much. Appreciate it.
You're welcome. Gary Kaminsky. Gary Kaminsky.
Great. Okay. So for TIA craft, you have the 160 days, you take your Travia, and now you have 45 days annual leave. You have a choice of not paying it out as a lump sum, or you could take the week by week payment.
So each campus kind of does it differently. Some campuses have policies about paying out annual leave. So you can, depending on how much you have, it's part of your consultation with your HR office or benefits office. Like they'll sit down with you and say, this is what makes the most sense. Spend down your annual leave, then go on Travia, or
Oh, I see. And
go
that,
on
but
Travia and get your annual leave paid out in a lump sum. So it depends on what the campus allows and what makes sense for you. So that's part of the consultation. They'll project out how long you'll be on payroll as you spend down your annual leave and then go on Travia.
oh, I see. So you could do the annual leave first, then go on Travia, but you don't have the
Yeah,
choice to do it
yeah.
after.
Once you're done with Travia, you can't go on annual leave.
Okay, I got it. So it's be lump
Yeah.
sum then. Okay,
Yeah,
thank you.
you're welcome. Teresa Mattis.
Hi, good morning. I just had a
Morning.
question about, I kind of wrote down a question when we were on the eligibility for health benefits. And right now, I'm 57 and a half with 33 years of service, so certainly I'm eligible. But I'm concerned about health benefits between the age of retirement. So say I retire in another year or year and a half, will I have health benefits, once I leave, or will I only get them again when I'm 62?
No, the age 62 is for TIAA, but if you're in a tier where it depends on your tier. So some tiers,
Right, I'm sorry,
you can-
I'm TIAA, I'm not
oh, you're
TRS. I'm
TIAA.
TIAA.
Okay, so yeah, TIAA, you have to have 15 years and be age 62. So if you wanted to leave before then you would have to, if you have 15 years at the time that you leave CUNY, you would have to arrange for your own health insurance until you turn 62. And then when you turn 62, you can come back and ask for your retiree health, depending on where you worked in the intervening years.
Okay, that's what I thought I heard. So I just wanted to make sure of that. Okay,
Yeah.
thank you very much.
Okay. Jane?
Thank you.
Oh, I'm sorry. Go ahead, Jane. There was someone before you, but go ahead. It's okay.
Thank you. I am in my 70s and I work full-time, member faculty TRS. My husband is over 65 and is planning on retiring. Does he does he stay on my insurance? Does he go to Medicare? And then does he get the Part D? In other words, I'm going to stay working. How does that all work?
As long as you're on an active employer sponsored plan and he's on your plan, he doesn't have to enroll in Medicare Part B until you retire, and then you both will enroll in Medicare Part B.
And that's my final question. I understand you apply for Part B 3 months before you want to take it. If I go on Travia leave, when does that 3-month clock set? Is it the end of Travia leave?
Yes, because while you're on Travia leave, you're still receiving a full paycheck, so you're technically still active. And then if you're faculty, you're if you take Travia, which is usually the most customary, if you take Travia in the spring,
Yes.
and you have the maximum and you're covered the entire spring by Travia, then you're on annual leave, you're on summer leave in the summer, July and August. And so that last day in August before the fall semester, August 25th or 26th, that will be your retirement date.
And so I would apply for Part B.
So then
3
right.
months
So
before
then
that.
3 months before that, but with an August 1 effective date.
Oh, really? Okay.
Yes. August 1 effective date. It should always be the first day of the month in which you retire or turn 65, whichever is later.
And so that would be, I apply like June 1, June, July. No.
Yeah,
May
I mean,
1.
yeah, you don't have to apply 3 months ahead. You could apply a month or two, but the 3 is like the maximum.
I see.
Yeah.
That's very helpful. Thank you.
Okay.
So
Iris Lopez?
May or June 2027, I must apply for.
Somebody's unmuted and we could hear you. Iris, go ahead.
Iris, you have to unmute yourself.
We can't hear you.
I'll unmute you if I can.
Okay, got it, okay.
Okay.
I had a similar question as the previous person who just spoke. I'm taking Travia in the spring of 27, and I'm going to be, I have all of my sick days coming to me. So I wanted to know technically what was the last day, last month that I'd actually be working, so I know how to count backwards or forward. And did you say it was the last day before, or the day before classes actually begin? That's
Yeah.
technically.
Yeah, the last day in August before the first day of the fall semester will be your retirement date.
Okay, so that's how I count. All right.
Yeah.
Good. Okay. Thank you. That was my
Okay.
question too. Thank
Okay,
you.
good. Lourdes Rosario.
Lourdes, you have
Lourdes.
to unmute yourself.
Yes, I'm sorry.
Okay,
Okay.
go ahead.
Yes, good morning. I know. Okay. I'm just wanting to know where the CLTs fall into perspective, because every time is they say HEOs and they say faculty or instructional staff. So I'm not sure exactly where the CLTs fall when some of the conversations is going on where what applies to us.
It's hard for me to go into that right now, but you can email me offline and I will send you a summary for CLTs.
Okay, thank you very much.
Okay, you're welcome. Elaine?
Yes. Can you just mention a little bit about the GHI senior care? I'm currently on Emblem, but
Okay.
it seems like senior care is probably the better way to go once I
So
retire.
I'm glad you brought it up, because the senior care plan is unique. Of all the plans that are offered to retirees, the GHI senior care plan is unique in that it coordinates with Medicare. Medicare, if you go to a Medicare doctor, and most doctors in the US accept Medicare. If you go to a Medicare doctor, Medicare will pay 80%, they will be primary. The senior care plan will pay the 20%. That's your secondary or supplemental plan. Between the two of them, after you meet some annual deductibles, you'll get pretty much 100% coverage. And that is a unique coordination that doesn't exist with the other plans. The other thing that I wanted to say about that is that because it's a plan that accepts all Medicare doctors, it doesn't matter where in the country you live. So it's available, it works nationally because they're Medicare, and the Medicare doctors obviously are all over the country. So that's the beauty of that. The only caveat to that is that if you retire before age 65 and you're not yet eligible for Medicare, you're on an active plan. So if you're in the GHI, the NYCE plan, you'll be limited to the network of that plan. So if you live outside, if you're going to move outside of the New York area, you should make sure that you can find doctors where you're going that accept that plan, because it's a network oriented plan. Once you turn 65 and if you go on the senior care plan and Medicare, that won't be an issue anymore. It's only an issue if you're under 65.
Celine, we have time for one
yeah.
more question because
Christina,
I've made Michael.
I promise you I will answer all your questions
in the chats.
In the chat. Christina.
Good morning.
Good morning.
I'm planning on retiring this spring semester, which means August 25th, because I will not be starting the fall semester.
Okay.
The effective date of Medicare Part B would be August 1st.
Right.
My concern is if there are ongoing medical issues that are being covered, as it is now with this new plan, some providers look at your age and think you're Medicare, and they bill Medicare rather than billing our insurance.
Mhm.
Is there a problem? And normally people would take a look at that and go to Medicare rather than going
Well,
to the,
you have to coordinate, you have to manage that yourself. So on August 1, you enroll in Medicare, but you're still on an active plan. And the active plan that you're on is more generous than Medicare. So up until the 25th, the 26th is when the senior care plan will go into effect. So
Okay.
you have to make sure that between August 1 and August 26, if you go to the doctor, you don't give them your Medicare card. You give them
Okay.
the Medicare card after your retirement date, and then your doctor should file the claim with Medicare first. And then behind the scenes, it'll automatically, the balance of the claim will go to the senior care plan. So you don't have to do that. So just, from August 1 to your retirement date, as long as you're still considered active, you use your active plan. And then on the 26th, you revert to Medicare being primary.
okay, so even though it's effective as of August 1st, it's not really usable
Don't use
until
it.
you actually
Right.
retire.
Don't use it. Yeah.
All right,
Yeah.
thank you.
You're welcome. Okay, guys.
I've
All right.
made Michael a presenter
You have.
already.
Oh,
Yes.
thank Jenna. What would I do without you?
I don't know.
Michael, are
I
you
don't know
there?
either. I don't know
Right.
either, Jenna.
Me
My
neither,
God.
Michael.
We
I
would
am-
just be
I am
adrift.
here.
We would
Thank
just
you.
be
Thank-
out there adrift, wandering the streets.
Were you talking to me?
Where's the kitten?
Everyone, please remember to mute yourselves.
Please
This is
mute
recorded.
yourselves.
I think you
Hi,
said Michael. I
Michael.
think it was me.
No, Michael
I wasn't
Foley.
sure it was
No,
me.
I'm sorry.
Michael
That's
Foley.
me.
Michael Foley, PSC.
That's me.
I'm sorry.
Hi, everyone. Hello, everyone. My name is Michael Foley. I'm the Director of Communications for the PSC Community Welfare Fund. If I have crossed paths with anyone on the call, it's nice to talk with you again. First of all, congratulations. You are on this call because you are either thinking about retiring or you have begun the retirement process. I trust you've had an enjoyable and fulfilling career at CUNY, and you are ready to make one of those big life steps, and that's retirement.
Where are you going?
Listen, it's very important to realize you're getting a lot of information thrown at you fast, and it can be confusing, but I want to emphasize to everyone that there are numerous people out there who are ready and willing to help you. All of the information you're getting today also is just a few clicks away on a couple different websites, but there are very skilled and helpful people out there. People like Delfino, people like Jenna and Talene. Here in my office, you've heard a reference to Sandra Zaccaneta. Sandra Zaccaneta is our retirement counselor. I'm going to go over exactly what she does and how you can reach out to her. But what I want to do is I want to give you a quick overview of what you can expect in retirement as a PSC CUNY Welfare Fund member. So I'm going to share my screen. Okay. Can everyone see my screen? Jenna, good? Great.
Yeah. It's clear.
All right. First, a little trivia. How many retirees do we have at the PSC CUNY Welfare Fund? This is the group of people that you're soon going to be joining. 7,000. Our youngest retiree, 49 years old. This is most likely a disability retirement, but gives you a sense of the kind of things that can occur. Oldest retiree, 102 years old. A few years back, our oldest retiree was 108. So I trust everyone has a good, long, and healthy retirement. As you can see, many of our members do. Retirees age 100 and plus, 21. That number tends to go down, unfortunately, but in any case, you're going to have excellent health benefits in retirement. So hopefully that number will stay stable. Now, on our website is this page. I'm going to put a link to this page in the chat. This is a checklist. At the top, thinking of retiring. It lays out exactly everything, roughly, what you need to do. Go to this page, bookmark this page, and refer back to it if you are concerned or confused about anything. It lays out all the details. Doesn't matter if you're TIA, doesn't matter if you're TRS, doesn't matter how old you are. It's all covered here. One of the important things that's covered on this page is how to make an appointment with Sandra Zaccaneta, our retirement counselor. It's important to remember that Sandra counsels TRS pension folks exclusively. TIAA has their own retirement counselors. If you have not met with a retirement counselor at TIAA, call them up, make an appointment. They're there to work for you, and they will lay out the sometimes confusing process of how a TIAA pension works. But if you are a TRS pension person, and if you have not, call Sandra. The phone number is on this page. Make an appointment, and she is sort of a retirement savant. She can go over everything with you and clear up any concerns you have. Getting back to all those folks that are out there that can help you. If you're in the PSC now, you may want to consider joining the PSC's retiree chapter. Joining the retiree chapter does a couple things. It allows you to connect with colleagues. It allows you to tap into some of the resources that the retiree chapter makes available. They have folks that are experts in healthcare, experts in Medicare. They meet regularly via Zoom. And it also keeps your access open to New York State United Teachers. In other words, New York State United Teachers requires you to be a union member of some kind to continue your NYSET benefits. So you may want to consider joining the retiree chapter. It's $85 a year, and it's a great group. Don't want to sound like a salesman here or anything. Keep in mind that the welfare fund is independent of the union. We're affiliated with the union, and we're affiliated with CUNY, but we're independent of both. But I'm a regular attendee for their meetings. It's a wonderful group, and people always get a good amount of information from them and can always ask questions as well. NYSET itself. NYSET benefits are extremely underrated. There's some great stuff available to you as a NYSET member. So if you want to keep your access to NYSET, and stay enrolled in NYSET, you do have to be in the retiree chapter of the union. You can contact the union directly. If you need that phone number, you can reach out to me or just look it up online, and you'll get through to them and they'll take care of that. Bear with me here. Okay, just a quick overview. So we serve, as hopefully you understand, the PSC CUNY Welfare Fund provides you with your drug, dental, hearing, and vision benefits while you're active and in retirement. We serve all of the campuses. We have a staff of about 12 people. We support 20,000 members and their dependents and retirees. So that number actually is kind of double. It's about 40,000 people we serve. Our bottom line is quite healthy, thanks to excellent support from CUNY and from the union. We're funded on a per member basis. All of our financial documents are viewable on our website. You can see exactly what our bottom line is and how we safeguard our finances. We're run by a board of trustees. We're as transparent as we can be, and we're proud to offer our services to all of you. Prescription drugs, now and in retirement. So if you are an active employee right now, you are hopefully familiar with the CVS Caremark prescription drug plan. That's how you get your prescription drugs as an active employee. If you retire and you're under 65, you stay on the CVS Caremark prescription drug plan. Once you turn 65, you transition into what's called CVS SilverScript. Now, SilverScript is a Part D Medicare-based plan, but it's unique to you as a CUNY retiree. I want to emphasize again something that Talene mentioned. When you retire, you're going to get a lot of information about what you need to sign up for. A, B, people are going to try and sell you Medicare Advantage plans and things like that. Ignore all of that. Also ignore any attempts to sign you up for a Part D drug plan. You do not need it. If you buy a drug plan, you're simply paying for something that you already have. So you transition from CVS Caremark into CVS SilverScript. The plans are comparable and they're comprehensive. Now, as an active employee right now, the city has what's called the PICA program. This is for specifically injectable medications and chemo drugs. Now, as a Medicare eligible retiree, you'll get those drugs from the SilverScript program. That transitions over as well. And also, once you enroll in Medicare, diabetic drugs will come from the PSC Community Welfare Fund SilverScript program instead of your basic health plan. Now, let's talk about the basic health plan that everyone got shifted into on January 1st, if you're active right now. That's the NICE PPO plan. There may be some confusion over how that impacts the welfare fund. The short answer is it has no impact whatsoever on the welfare fund. The city of New York has always covered some prescription drugs, such as through the PICA program, injectables, chemo drugs, and diabetic drugs. Now, if you're active right now, what's been confusing is the city moved management of those programs into two things, Prime Therapeutics and Amazon Pharmacy. That does not mean you need to enroll in Amazon Pharmacy or Prime Therapeutics in retirement. Once you reach retirement age and you officially retire, you do not have to worry at all about the NICE PPO plan or Prime Therapeutics or Amazon Pharmacy. CVS SilverScript takes care of everything, including your 90-day supplies, including, as mentioned here, your injectable and chemo drugs, as well as your diabetic drugs. So again, do not buy a Part D plan. You get your prescription drug plans from the welfare fund. Gotta mute yourself, folks.
Mute yourself. Please mute yourself.
Okay. I call this slide up only to emphasize again, please do not buy a Part D drug plan. It screws everything up if you do that. You're going to be spending money that you don't have to spend. You get your prescription drugs from the welfare fund as an active employee and as a retiree. All the other welfare funds do not change. All the other welfare fund benefits do not change when you retire. If you're in the Guardian dental plan, you stay in the Guardian dental plan. If you're in the Delta dental plan, you stay in the Delta plan. If you're in Davis, if you utilize Davis Vision, you continue to utilize Davis Vision. True Hearing stays True Hearing if you need hearing aids. Oh, by the way, we've had some recent news. Brooklyn College is now an official True Hearing provider. As many of you may know, Brooklyn College has had an audiology clinic for 30 plus years. It's world renowned, basically, and we've been working on this for a while, but we successfully added them as a True Hearing provider. So as you enter into retirement, if you've got some hearing aid issues, you may want to think about calling True Hearing and tell them that you want an appointment at Brooklyn College, and they'll take care of it. That way you're keeping it in the family. You get to ride on the 5 train to Flatbush, and that can be a lot of fun. Some welfare fund benefits do end at retirement. Disability insurance ends at retirement. Obviously, you're no longer employed by CUNY, so you don't get that disability benefit. The death benefit for employee survivors goes away. If you had, thankfully, since I'm talking to you, this has not occurred. If you had passed away while you were active, your beneficiary would have received $5,000. We do offer survivor benefits in retirement. I'm going to discuss that in a moment. Insurance premium payments. Let's talk about two very important things: catastrophic major medical insurance and long-term care insurance. Many years ago, the PSC CUNY Welfare Fund offered members a catastrophic policy and/or a long-term care policy. I'm hoping that many of you on this call did make the decision all those years ago to buy those two policies, because we can no longer offer those policies and have been unable to offer them for well over 10 years now, because we cannot find an insurance company that will underwrite these policies anywhere close to affordably. So if you have both of those policies, you likely had also set up automatic deduction from your paycheck. Now is the time to think about transferring that automatic deduction to your pension or to your bank account. In other words, you want to make sure that you protect these policies. These companies make no money off of you. They would love it if you went away. So if you start missing premium payments, they're going to say, oh, this person's out of here. Great. We can now upcharge someone else. So please protect your enrollment in the catastrophic policy and protect your enrollment in the long-term care policy if you have them. Catastrophic, I kind of don't like the way they call it catastrophic. I consider it more of an everyday policy. It covers all out-of-pocket medical costs. Now, you as a CUNY active employee and as a retiree, you have really good benefits. You're not going to incur a lot of out-of-pocket costs, but the catastrophic policy is there for you if you do. So let's say you go into the hospital and an anesthesiologist walks into the room and looks at you and decides to charge you $5,000 and they're out of network. That's where the catastrophic policy comes into play. Catastrophic is also very, very good for in-home care. Long-term care is very good if you need to go into a facility of some kind, or if your spouse is named on the policy and needs to go into a facility of some kind. Now, for the folks on the call that do not have these policies, your best source, if you do want to get them, now it's going to be difficult due to age and possible medical history, but it's not impossible. Long-term care is always offered by NYSIT. NYSIT has a page on its website where you can input your data, your age, any medical conditions, things like that, and you can get a rough idea of what the premium would be for a long-term care policy. Don't dismiss it out of hand thinking, well, I'm too old or I'm too infirmed. At least see what the number is and see if you can work it into your budget, because we all know that going into a nursing home, an assisted living facility or whatnot will destroy your finances. So if you can protect that by getting a long-term care policy and it's in any way remotely affordable, you might want to consider it. Likewise for catastrophic. NYSIT does offer a catastrophic major medical policy. They're a little cagey about how they do it. They kind of announce it with at short notice, and it's only available for like a month. I have heard rumors that they may do it this year. Keep an eye on the NYSIT website. Keep an eye on our website. We try and promote it if it does happen. And it's kind of a rare opportunity to purchase a catastrophic policy. Now, of course, you could go out on the open market and try and purchase both of these policies. If you can find an insurance company that will take you, they are going to want like everything. So going through NYSIT is at least somewhat affordable and may work for you. And again, if you've gotten used to automatic deduction from your paycheck, I would urge you to consider that automatic deduction from your pension, be it TIAA or TRS. It's a great way to sort of make sure that if you travel or something, or you forget about a premium payment, that way that premium payment stays in place and your policy is protected. This is our website. Don't hesitate to go there. Literally everything I just said is on this website. We pride ourselves on answering emails, picking up the phone. I may refer you to Delfino. I may refer you to the Office of Labor Relations if it's a question about your GHI senior care plan or something like that. But we will talk to you. You can call me. I will pick up the phone. And if I can't solve your problem, I will try and give you advice or some guidance on how to solve your problem. There are so many wonderful people at CUNY and so many wonderful people at the union that are available to help you. But again, I just want to emphasize, you are not alone in this process. There are ways to find this information. There are ways to troubleshoot anything. And if you just have any questions whatsoever, do not hesitate to reach out to someone at CUNY, myself. I can connect you with our staff members if you've got questions about prescription drugs or anything like that. Answering questions makes me happy. So please, let's have some questions.
Before we start, Gerald, before you unmute yourself, is your question for PSC? Yes, okay.
Hi, Gerald.
Unmute yourself, Gerald. Gerald, we can't hear you. Gerald, we can't hear you still.
Take your time, Gerald. We can come back to you if you want.
He's muted. He should unmute.
I know, but he has to unmute himself. I can't unmute. It's not allowing me to unmute him.
It's unfortunate. He's been waiting.
It's on the top to unmute yourself. Look at your screen And it's
Where
right
the little
side.
microphone.
Can
There we go.
you
Gerald,
hear me
you get
There
it?
you
now?
go. Yes, we
Awesome.
can hear you, Gerald.
Thank you. What is Delfino's name and how do you contact him?
His name is
full
Delfino Rojas.
Rojas. Okay.
Yep.
And how would you contact him if you need him?
His name is on a billboard in Times Square.
Delfino, are you still on? Can you
Delfino,
put your
please
information in the chat?
Yeah.
He'll put his information in the chat.
I give everybody Delfino's phone number, so don't worry, Gerald.
Georgia M. I can't see the full name. Georgia M, unmute yourself.
Good morning.
Hi, Georgia.
And, thank you for the seminar and thank you, PSC CUNY.
You're welcome.
So question, when we were, and I'm on Travia currently and will be retired as the day before the beginning of the fall semester. And I'm over 70. Do I need to notify the union that I'm retiring or will it happen automatically? Will I automatically be enrolled in the Silver Scripts? How does that happen?
So the process of enrolling in the welfare fund is really easy, but it starts at your HR office. When you told HR that you were getting ready to retire, they should have given you the documents to enroll in the welfare fund. You return those documents to HR, and then HR tells us that Georgia McGill is retired and you can add her. Once we get those documents, it happens pretty much the same day. So, but that's the process. You go to HR, you say, I want welfare fund benefits to continue in retirement. They give you the forms, you fill out the forms, return them to HR, and HR tells us.
And those when do those become effective? The day of our
same schedule that Talene sort of mentioned. Think of the end of the month, first of the next month is when things become effective.
Okay. So we should enroll like August 1st in that?
Good idea. Yeah, good idea. And if you, for instance, let's just say you do that, you may want to stock up on some timed medications or things like that.
Thank you. Good advice. Thank you.
You're welcome.
Denisha Marshall, unmute yourself.
Yes. Good morning,
Denisha.
everyone. Hi. I have a question about the catastrophic medical coverage.
Yes.
So that just covers the medical, but let's say, for example, you have a catastrophic event.
Yes.
And you run out of annual leave and sick leave. It doesn't cover anything having to do with it. Okay.
No.
I see you shaking your head.
No,
okay, no problem.
No, it's
Thank
a
you.
very generous policy. The policy itself is on our website as well. If you've got it and you haven't looked at it in a while, I would urge you to look at it. I'm happy to mail it to you if you'd like.
No, I could go on the website. Thank you.
Yep, there's a link to it right on the website under catastrophic major medical.
Okay, thank you.
Laura Silverman, unmute yourself.
Hi, thank you so much for this information. It's
Hi,
super
Laura.
helpful. Hello. So I am 32 years full-time HEO series TIAA, anticipating potentially an earlier retirement pre-62. So my concerns are all focused on bridging the gap, healthcare insurance gap, and all of this stuff before I turn 62. So how would that work with the PSC given the coverage with drugs, et cetera, pre-62?
Right. In other words, if you meet the eligibility to retire for CUNY and meet the eligibility for medical benefits through the city of New York, then the welfare fund follows that. So if you meet eligibility for city benefits at the age you're talking about, you will be eligible for welfare fund, drug, dental, hearing, and vision.
So for clarification, although I'm not able to tap the health insurance on TIAA until 62, if I retire, 2 or more years prior to 62, I'll still get PSC coverage, but I won't get
some PSC. You won't get prescription drug.
You won't get your prescription drug. You'll have to get it on the open market.
Yep.
Okay. But then I turn 62
and then you'll get the full gamut.
Okay, thank you.
Oh, before we move on, I just want to go over also, I mentioned survivor benefits earlier. In retirement, if you pass away, your spouse is protected. Your spouse can purchase the welfare fund benefits. at a very affordable rate. It's a little under $4,000 for the year. So on the open market, a drug, dental, hearing, and vision plan would cost far more than that. So in retirement, you might want to have sit down with your husband, your wife, your domestic partner, and say, hey, listen, if I pass away, call the welfare fund, let them know, and that you want to purchase the welfare fund benefits. That way you cut COBRA out of the picture and you purchase them directly from us. So your spouse is protected several ways if you do pass away in retirement. Moving on from that,
Loretta, unmute
somewhat
yourself.
depressing note.
Good morning.
Good morning.
Loretta.
Thank you so much. I'm sorry if this is very unique. My husband's a NYPD retired sergeant, and I've been using his benefits for almost all of my 30 years at CUNY. Is there a benefit for me to try to move over to
Possibly.
PSC?
I mean,
who would I talk to about that?
Yeah,
Your HR department.
Yeah.
Okay.
Yeah.
But the IRMA is one of
Can I
IRMA's.
chime in?
Yeah, you can chime in. IRMA is one part, but it's the same health
This comes
insurance.
up a lot. I'm not familiar with what the NYPD benefits are for retiree surviving spouses. But when we have two CUNY employees who are married and they both have access to their own benefits, I always tell them they should separate them, because when one of you passes away, if one is on the other plan and one of you passes away, in the most difficult period of your life, you're scrambling around trying to figure out what your health insurance coverage is going to be. So if you have access to your own retiree benefits in your own right, if something happens, then that's one less thing that you need to think about. Having said that, I'm not familiar, because with CUNY retirees, once the retiree passes away, the spouse who is on their plan loses their coverage. But I don't know what the rule is for surviving spouses of NYPD retirees. So that's something you should find out from them. If you can keep your benefits, if your husband passed away, would you be able to have access to those benefits for life? If not, you should get your own retiree benefits, and then you don't have to worry about it.
Thank you.
Okay.
Iris, unmute yourself.
Thank you. And thank you for this great seminar. I have two questions. The first one is about the catastrophic insurance. I have it.
Excellent.
And I'm wondering, thank you.
Let's use it.
Yes. How do I continue making payments after I retire? I'm going on Travia in spring.
You've got a couple different options. If you're TRS, are you TRS or TIA?
TIA.
You can call them and tell them that, listen, I want to set up automatic deduction from my pension account. And you'll need to give them, your the information from the company that manage your catastrophic plan, AMBA and whatnot. So it's two phone calls, one to AMBA to let them know that you're changing automatic deduction from your paycheck to your pension. And then you're going to give AMBA the information that TIAA gives you on how to do that.
Okay, thank you.
There could be a period of time. It's very common for a month or two where you do not have automatic deduction. So, because it takes time for both entities to set it up, both AMBA and TIAA. So be prepared for that. Be prepared to have to make possibly one payment directly yourself. And you also always have the option of setting up automatic deduction from your bank.
Okay, and thank you. And then I can get the information of like the contact information for the catastrophic through the PSC.
On our website. Yep. Okay. Right there on our website. Yep.
Okay, and the other question, and I'm sorry this is repetitive, but I just wanted to make sure I understood it correctly. Mm-hmm. I'm retiring. I'm taking Travia in the spring of 2027.
Yeah.
So, do I have to fill out a form so that I could continue my PSC CUNY welfare benefits after I retire?
Well, when you go to HR,
everything will be done in HR, right?
Yeah.
For after your Travia, what you have
HR
to meet
will,
with HR.
they'll almost hold your hand.
All right.
All right. Okay,
Talene,
thank you.
Gilbert is on. How many more questions can we
Thank you
take?
very much.
We can take a couple more.
Okay, Gerald.
Before
no,
we
it's
move
not
on,
Gerald.
Talene, I just want to get back to one thing that
Carmen is next.
Laura mentioned, and that's if you're looking to bridge, and you find yourself having to go on the private market for something to bridge you into that age 62 period of time. Please be cautious. If for whatever reason you need to go on the private market to look for a medical benefit plan or something like that, go through a reputable agency of some kind. Think about like AARP or something like that. There are so many bad actors out there that are going to try and exploit you. They're going to try and upsell you things that you don't need. They're going to give you shoddy policies that won't work. So it helps in this case and in many other cases to maintain a healthy level of skepticism about the things that you're going to be told. Check things out, make a phone call, call me, call Delfino, call other people, and before you agree to anything, do your due diligence. Your future self will thank you.
Carmen Marte, unmute yourself, ask your question.
Hi, good morning. I'll make it short. I just want to know, are we getting a copy of this presentation?
It was
think it'll be
emailed
posted.
to everyone.
It was already emailed.
About Michael's presentation.
Oh, okay.
Michael,
And this is recorded, so you'll be able to see it online next week.
Okay. Well, thank you.
Well, right now, after it's over, you'll have the recording actually. Rena, you're next.
Yes, hi, thank you. I'd like to know, can you hear me?
Yes.
Okay. Do we have the name of a reliable contact person at TIAA? Because when you call the general number, they don't seem to know CUNY very well. Do we have a person there who understands, about the $50,000 and the $10,000 and the?
You should. There are TIAA reps assigned to the various campuses. So you should go to your benefits person and ask them. Sometimes they set up days where a CUNY rep comes on campus and takes appointments. You can also go on their website and make an appointment with with the TIAA rep and have a phone conversation with them and ask them all your questions, all the questions that you have about your plan and the 50,000 and this and that. But we do have TIAA reps that are assigned to the campuses. You just have to find out who the rep is for your campus.
Okay, got it.
Honora Raphael.
This is the last question we're going to take.
Okay. And then everybody else, I'm going to lower your hands because we're going into the next part of the presentation. You can just ask your questions in the chat. So, Honora Raphael, please ask your question. Unmute yourself, ask your question. Okay.
Go to the next person.
Adele Broges.
Yes.
Hi, Adele.
This is Adele. I have two questions. My first question is, I once had a different hearing aid company. Hear USA used to be the benefit. So I dealt with them and I got hearing aids, but I really need a new pair. So how does True Hearing work? Hear USA, we had to call True Hearing and they'll tell you where there's a rep, where they have a.
That's correct, Adele. Yes. Yeah, keep in mind that the hearing aid benefit is once every 3 years. So if you haven't.
5 years ago. It was 5 years ago.
Okay, if 3 years have gone by, I would urge you to call True Hearing, set up an appointment. They'll give you, there's a special phone number on our website, unique to CUNY folks. Call them. They'll set up an appointment at the nearest True Hearing provider, and you'll go in and get yourself a brand new pair of hearing aids, generally at no cost.
Good. Thank you very much.
You're welcome.
Here USA was very good also, but now you're not really using them. And my other question is, I have Guardian for dental insurance.
Yes.
Right now I'm still active. But
yes.
my over 75, I'm actually even in tier 2 from years ago. But I wasn't teaching all this time, but but now it's soon time to retire. So my only question is, I got through Guardian recently some dental implants, and
Yes.
My dentist said that he thought that after you retire, the benefits are not the same. Do you know if the Guardian benefits are different if you retire?
The Guardian benefits specifically regarding implants just recently changed, but it's not impacted by retirement or being active. The Guardian plan for retirees and actives is roughly the same. Implants, the change we had to make recently is we cover 2 implants per year, and any associated costs, we pay up to $3,500 for those implants.
Right. Okay. I mean, I did do very well with them. I was very happy. But I want to know if I want to retire in 2 years and I need 3 implants, can I get 2 1 year and 1 the year after I retire? It doesn't matter if you retired, you could still.
That's correct. Yeah.
Okay. And the other question is not exactly related to this, but I want to ask it earlier. Is that Sandra Zaccarnetta, the person you have to speak, Sandra, that someone keeps on talking about?
Yes.
That's right. My question is, I was an adjunct for many years, both at Queens College and at Queensborough Community College, and then it's already 16 years on full time. 16 years on full time at Queens College.
Wow.
So my question only, first I was an adjunct for 18 years. I taught for the Board of Education first, and then before I had a family. But the point only is that I'm 16 years full time here at Queens College, so I know and I'm over 75, so I qualify for everything. But my question only is that when I taught at Queens and Queensborough at the same time for 18 years, I don't think that they accredited me for all the service that I had. So who is the person how can I get a TRS? I'm in TRS. I don't have the right amount of service.
Adele, you have to go to your HR office and get their assistance, because this is, that's a personal circumstance that we don't want to discuss, with a whole group of people. But go to the office, and also you can contact TRS and you could tell them that you have service that you believe is not being credited, and they will reach out to the campuses that you tell them that you worked at and get your full service history and then do their calculation.
Right. I think the place where I am now, they gave me all the credit. This is the place where I haven't been now in the last 16 years. They're the ones who I didn't get all the credit for.
You have to go to your HR office. We could talk offline also, but I have to move on because I didn't expect to go this much over, and Gil is waiting. So,
thank you.
And I'm going to lower the hands for everybody else, and then you just ask your question.
Thank you, everyone. Appreciate it.
Michael.
Thank you, Michael.
My contacts are out there.
So much.
Good luck.
Okay, Dr. Gil Kunkin is from the New York City Department of the Aging, and he's going to talk to us about Medicare. And while he's talking, I will continue to answer the questions in the chat.
Hi, thanks, Talene, and good morning, everybody. Are you seeing the slides?
Not yet.
Not yet. I did make you presenter.
Yes, he is in the presenter category. I do see that, but I don't see the slides yet.
And still not yet, huh?
Mm-mm.
I sent them to you, Talene. Could you?
Let me bring them up. 1 second. How's that? Can you see it?
Let me see here. Yes.
I have your slides up, yes. Gil. Okay. You could start.
Thank you so much. So HICAP, the Health Insurance Information Counseling and Assistance Program, is a component within the Department of Aging that has trained volunteer counselors that can assist you one-on-one, either over the phone or in person, with understanding your Medicare benefit and how Medicare works with other health insurance programs. Now, when you do have retiree benefits, we always suggest that you go first to your own HR people but then feel free to come to HICAP. We can be reached at the number on the screen, which is more easily remembered as 212-AGING-NY. The numerical number 212-244-6469. Let's go to the next slide, please. So today I'm going to cover these topics. We'll talk about how to get you enrolled in Medicare. We'll explain what the out-of-pocket costs are under original Medicare, which is what we are going to focus on. I'll talk about how supplemental insurance can help you with these out-of-pocket costs. We'll focus on the senior care option. I want to go over some non-covered services under original Medicare that people often get confused by various ads that are on television. Some important things to know about safeguarding your benefits and resources that are available to you. Let's go to the next slide, please. So Medicare is a federal program for those who are age 65 or older. You can be on Medicare at any age if you've been declared disabled by the Social Security Administration. And if you're on kidney dialysis, you're automatically entitled to Medicare coverage. Next slide, please. So to begin with, we're going to take a quick look at the Medicare alphabet. Medicare Part A is your inpatient benefit. It covers hospital insurance. It covers skilled nursing facilities, hospice care. Part B is your outpatient benefit. These are your doctor visits, lab visits, physical, speech, occupational therapy visits, and preventive services. Part A and Part B are included in original Medicare. Part D is your prescription drug benefit. It is voluntary, it is optional, but it is strongly suggested that you have it because for every month you go without Part D coverage when you should have had a Part D plan or some other form of creditable drug coverage, you could be subject to a penalty. And retiree health benefits typically provide drug options. Now, you may hear the phrase Medicare Part C. Medicare Part C is the designation for Medicare Advantage plans. These are private plans run by private insurance companies. They are for the general public. They are not for you. Go to the next slide, please. Now, before we get into the out-of-pocket costs and enrollment, I just want to mention that Medicare has several free preventive benefits that are not subject to either coinsurance or to the deductible under Part B. Strongly recommend that you speak to your primary care provider about which of these preventive benefits you are eligible for, because we all know that the earlier that we can diagnose a problem, the better chance we have for a positive outcome. Let's go to the next slide, please. Let's talk about enrollment. If you are receiving Social Security benefits for at least 4 months prior to turning age 65, you will automatically be enrolled in Part A and Part B. Again, if you're receiving Social Security benefits for at least 4 months prior to turning 65, you will automatically be enrolled in Part A and Part B. If you are not, you have to take affirmative steps to enroll. Let's go to the next slide, please. Now, Part A is premium-free for approximately 99% of the population. If you worked at least 40 quarters, which equates to 10 years, and earned the required credits and paid Social Security taxes in the United States, or if your spouse did the same, you are eligible for premium-free Part A. If you are collecting Social Security benefits, Part A is mandatory. If you're not collecting Social Security benefits, Part A is voluntary. You can enroll in Part A at any time after you turn 65. We recommend that you sign up for it at age 65 because it is premium free. Let's go to the next slide, please. So now we're going to discuss enrolling in Part B, and there are 3 enrollment periods. The first is the big one. It's the initial enrollment period. This is when you first turn 65. It is a 7-month window that surrounds your 65th birthday month. 3 months before your 65th birthday month, the month of your 65th birthday, and the 3 months following. If you enroll in the 3 months prior to your 65th birthday month, your Part B coverage will begin the first day of the month of your 65th birthday. Should you wait to enroll during the month of your birthday or in any of the following 3 months of the 7-month initial enrollment period, your coverage will begin the first of the following month. Next slide, please. Now, People often continue to work beyond age 65. And if, like you are covered under active employment from a large employer like CUNY with active health insurance, either through your own employment or through the employment of a spouse, in this situation, it cannot be a domestic partner, it must be a spouse. You can keep that active health insurance from your employer and delay enrolling in Medicare Part B. You will be entitled to a separate enrollment period for Part B when you decide to retire, or you can sign up for Part B at any time before you decide to retire. This special enrollment period will allow you to enroll in Part B within the 8 full months following the month that you are no longer covered through current employment. But this is an active election and it requires forms from the enrollee and the employer. So let's go to the next slide, please. So the two forms are the L564 and the 40B. You can get these from the Social Security website at ssa.gov or from your HR office typically. One form is completed by your employer, which certifies to Social Security that you are covered beyond age 65 by active insurance and active employment. The other form is completed by you, and on that form, you will indicate when you want your Medicare Part B coverage to start, and you always want it to start so that there is no break between that and the previous active insurance that you had that would be terminating at that time. Let's go to the next slide, please. There is one more enrollment period known as the general enrollment period during the first 3 months of each year. If you sign up in January, your coverage will begin in February. February, your coverage will begin in March. And if you sign up in March, your coverage will begin in April. This is important because Medicare will levy a penalty for any 12 consecutive months that you went without Part B when you should have had Part B. That penalty is 10% of the monthly premium, the standard monthly premium for that given year, and it will get added on to all future premiums that you pay. And sometimes, believe it or not, we will see people who show up in our office at age 85, 20 years after they should have enrolled. They didn't enroll for whatever reason. Maybe they were in very good health and didn't go to medical care. They are subject, in that case, to a 200% penalty going forward for each month they pay the Part B premium. So with Medicare, remember the early bird gets the worm. Be aware of enrollment periods. Are there any questions about Medicare Part A or Part B enrollment?
Hi, I have a question. You said there's no premium for Part A, but I have been paying $60 per pay period, and I do not have Part B yet.
I don't know what you're paying the $60 for, but if you worked for at least 10 years where you paid Social Security taxes in the United States, or your spouse did, you're eligible for premium-free Part A. So I am not sure what that $60 charge is for.
So who do I contact for that?
I would perhaps first start with your human resources people at CUNY to see if it's
reach out
related
to your HR department and see what that charge is for, and they'll be able to reach out to payroll.
Okay, all right.
Alicia,
thank you.
next.
Hi. Yes, I'm sorry. I have a question on, and I know you went kind of over it, but I just want to make sure I understand it. So the Part B is the doctor, correct, and outpatient services, and I'm going to continue to work probably to about 68. So do I have to enroll at 65?
No, not if you're covered by CUNY. If you're covered by CUNY's active insurance, you can delay enrollment until you retire.
Okay, and how long before I retire do I have to tell them that?
So typically, you would sign up for Part B. When you know your retirement date, I would start about 3 months prior.
Okay, thank you.
And contact Social Security, yes.
Michelle will be the last question, and then we'll let Gil get back to his presentation.
Oops. Hi,
Yes,
I
Michelle.
just want to quickly note, I'm going to be turned 65 in July. And I just want to know, how do I apply for Part A? I'm still an active employee and I probably will work for another few years. But I just want to know how to apply for, my birthday is July 28th. So I just want to check when and how.
Yes, you can contact the Social Security Administration, or you can set up an online account at ssa.gov and you can enroll online.
Thank you.
You're welcome.
All right, back
Oh,
over to
I'm
you.
sorry. The last question is, should I apply? It's 3 months prior to my birthday?
You can start at 3 months prior, yes.
Okay, thank you.
Mhm. Okay, so let's go to the next slide, please. So people with Medicare who are collecting Social Security, your monthly Part B premium will be automatically deducted from your Social Security benefit. If you're not collecting Social Security, you'll receive a bill quarterly. It'll be a paper bill. We strongly recommend that you open an account at medicare.gov, an online secure account, and pay the premium online. Let's go to the next slide, please. Now, when you enroll in Medicare, either Part A or Part B or both, you are issued this red, white, and blue Medicare card. Several years ago, you were identified by a Social Security number. No longer, you now have your own unique and secure alphanumeric number. One word of caution, neither Medicare nor Social Security will ever call you cold and ask you for your Medicare number. If anybody calls and asks you for your Medicare number, hang up. If for some reason you feel that your Medicare number has been compromised, immediately call 1-800-MEDICARE and they will send you a new Medicare card with a new Medicare number. Next slide, please. So there are two ways and only two ways to get Medicare. It's either Original Medicare, which is overseen by the federal government, or Medicare Advantage plans, which are private health plans where private plans, insurance companies contract with the federal government to provide you the benefit. Medicare Advantage plans are for the general public only. They are not for you. You may have managed care options in your retiree benefit package, but they are not the traditional Medicare Advantage plans that are sold to the general public. So today we're going to focus on Original Medicare, which is what most city retirees are in. With Original Medicare, your Part A and Part B benefits are administered by the federal government, and you can go to any provider that accepts Medicare in the United States, in Puerto Rico, in the United States Virgin Islands, or in the Pacific Territories. There are no networks with Original Medicare. There's nothing about my doctor is or isn't in the plan. If the doctor accepts Medicare, then you're fine. And there is also no pre-authorization requirements for higher cost procedures as there are in the public Medicare Advantage plans. So we're going to focus now on Original Medicare. Next slide, please. So there is a monthly premium with Original Medicare, and you're responsible to pay the monthly premium whether or not you're in Original Medicare or in any other form of Medicare. Now, the great majority, about 93% or so of the population, will pay the standard amount. And that amount this year is $202.90 per month. It will come out of your Social Security check if you're collecting Social Security. Otherwise, as shown in the previous slide, you'll be billed quarterly. Now, the other 7% will be subject to what is known as the income-related monthly adjustment amount, abbreviated as the IRMAA. Let's go to the next slide, please. Now, this is a very busy slide, so I'm going to take a few minutes to discuss it. The Social Security Administration takes tax information from 2 years ago, because that's typically the most recent information on file with the IRS. They look at your adjusted gross income, which is a line item on your tax return. They then look at another line item that shows whether or not you deducted tax-free interest. The two numbers are added together to come up with a new number known as the modified adjusted gross income. If your modified adjusted gross income in 2024 was $109,000 or less as a single filer, or $218,000 or less as a married couple filing jointly, you will be subject to the standard Part B premium in 2026, which is $202.90. But as you go down the rows of this chart and you see how your modified adjusted income level goes up in each row, you are then subject to higher Part B monthly premiums, starting at $284.10 a month, going all the way up to as high as $689.90 a month, based on your modified adjusted gross income, and this is per individual. In addition, if you have a Part D prescription drug plan, you will typically be subject to a surcharge on that, and you see what the additional premiums will be as you go down the various rows as you cross income thresholds. Now, the Part D
Gil,
surcharge. Yes,
Gil,
go
can
ahead,
I
Ms.
interrupt?
Mhm.
Gil, I'm sorry. I just want to interrupt I just want to say one thing while you're talking about this. For retirees who are subject to IRMA, even if you're not enrolled in Medicare Part D because you're getting your drug plan from the PSC Welfare Fund, when you're subject to IRMA Part B, you're also going to be charged in IRMA Part D, even though you're not enrolled in a drug plan. And unfortunately, the reimbursement of Part D is not part of your retiree benefits. You're only reimbursed for Part B, like boy. So if you see an IRMA Part D on your Social Security letter, it's because you're subject to it because you're also subject to IRMA Part B. Thanks.
Right. Yeah, thanks, Tony. Yeah. Now, the calculation is done every year by the Social Security Administration. So for 2027, they will be looking at your modified adjusted gross income from 2025. Now, sometimes we have a life-changing event like retirement or a change in marital status, or unfortunately the death of a spouse, and our income goes down suddenly, and it's not going to be at the same high level that subjected us to the IRMA. So if one finds themselves in that situation, you can use Form 44 from the Social Security Administration to appeal, and you won't have to wait for the following year's calculations, and you can provide the information that's more recent about your income, and the Social Security Administration will evaluate that and determine whether or not you'd still be subject to the IRMA, or perhaps might even lower your IRMA amount. Just want to make you aware of that. Now, as Talene mentioned, you are eligible as city retirees for reimbursement. Now, you get automatically reimbursed, I believe, for your standard monthly Part B premium every April. But for the Part B IRMA, you have to take affirmative action by going on the Office of Labor Relations website and filling out the forms. And you also have to include Social Security forms, the 1099 form and the Social Security award letter. And I'm going to use that as a prompt because I know my good friend and colleague Ravi Gopal is going to mention this when he talks about Social Security, that you should establish an online SSA.gov account as well, because oftentimes we get these forms, we misplace them, and when it comes time to apply, then we wind up having to call, and when we call, by the time we get through, then we have to wait another few weeks for documents to arrive in the mail. You can download all the documents that you need from an SSA.gov online account, and so we encourage both that as well as a Medicare.gov account. So let's go to the next slide, please. So original Medicare isn't free, and there are out-of-pocket costs that we're subject to for both Part B and Part A. There are 3 cost gaps for Part B, and there are 3 cost gaps for Part A. And it's important to understand that with original Medicare, there is no limit on how many out-of-pocket costs you can have or the amount of your out-of-pocket costs. So what are these gaps? With Part B, there is an annual deductible. This year it's $283. That is your first gap. After you meet the Part B deductible of $283, Part B coinsurance kicks in. That's 20% for most situations. I'll explain that in a moment. That is your second gap, your Part B coinsurance. Your third gap are what are known as excess charges if you're seen by a non-participating provider who can charge you up to an additional 15% over what Medicare usually and customarily allows. Now, again, you have to pay the monthly Part B premium regardless of how you get your Medicare. And as I mentioned a moment ago, lab work and preventive services are fully covered if they're medically necessary and within stated time frames, so we strongly suggest you take advantage of Medicare's preventive services. So let's go to the next slide, please. In order to understand the coinsurance responsibility that you have and understand how situations can occur where you're going to be responsible for more than the 20%, you need to understand the concept of assignment. Now, about 95% of Medicare providers nationally are known as participating providers. They accept assignment. It means that they have signed a participation agreement with Medicare, and they have agreed to accept Medicare's payment as payment in full. They will file the claim for you with Medicare, and then the claim will get sent after Medicare acts on it to your senior care supplement, which most of you have. Non-participating providers are still in the Medicare program, and they make up about 2 to 3% nationally of all Medicare providers. These providers have chosen not to sign an agreement with Medicare. And so they can act in one of two ways. They can decide to act just like a participating provider and accept assignment, in which case, after you meet the Part B deductible, you're responsible for the other 20%. Or if they don't accept assignment, they can charge a little more, but they just can't charge anything they want. They are subject to what is known as a federal limiting charge. The federal limiting charge is a maximum of 15% nationally. And in New York State, there is a further limit of 5% for everything except home and office visits. So for example, in New York State, if you had an outpatient Part B surgical procedure and you were seen by a non-participating provider, they can only charge you an additional 5%. But if you're across the river in New Jersey, for example, they could charge you up to 15%. Now, there is another category of providers who have opted out of the Medicare program entirely. So they are not in the Medicare program. This is about 2 to 3% nationally, a little higher in an area like New York City. These providers have to give you a contract when they first see you that explains that they are not in the Medicare program, that Medicare will not pay for any of their services, neither will a supplemental plan pay, and you're on your own if you want to use them, and you're subject to their full charge. So I'm going to pause now and ask if there are any questions about the calculation of the Medicare monthly Part B premium and about the concept of assignment.
Raise your hand if you have a question so that I can call on you, please.
Hi, I have a question. It's not about
No, wait a minute. Hold on. It's not your turn yet. Give me 1 second. Yan Yoras.
Hi, guys. Apologies in advance. They're doing work in my basement downstairs, so there may be banging in the background. I am planning to retire I am planning for Travia to end in January. I'm writing this up because I have some questions that I'm going to put in chat. But the one that I want to broach is, what happens if I spend part of the year in Thailand? What happens with health insurance for that?
So Medicare only covers you in the United States and in the Puerto Rico, the Virgin Islands, and the Pacific Territories. So if you're overseas, you are not covered by Medicare. To continue your Medicare eligibility, you would need to continue to pay your monthly Part B premium. Again, if you suspend your Part B when you go overseas, if you go more than 12 months without Part B coverage when you should have had it, and you don't have any other form of active insurance, and there are some situations where if you're working overseas and you're actively employed.
Yeah, it wouldn't be work. This would be retirement. I mean, the woman I'm with at present, she has a business in Thailand, etc. She wants to spend half the year there, half the year here. So that's what possibility is.
So in that situation, in order to keep your Medicare coverage current, you would continue to pay your monthly Part B premium, but you would not have Medicare coverage overseas. You would be preserving it for when you came back.
And would I be reimbursed?
No, you will not be reimbursed.
No.
Can I chime in?
Yes.
Let me chime in for a second. So, for regarding living abroad, as Gil said, Medicare doesn't work. Because you have the supplemental plan, this GHI senior care plan, the senior care plan may cover emergency claims, but then will only pay it on an out-of-network basis. And I don't know how much that is. So you may, if it's an emergency, not just a routine doctor visit, you may be able to go to an emergency room and get care and have some of it reimbursed to you by the health plan. Having said that, if you're living abroad and you're expecting your Medicare Part B reimbursement to be mailed to you, it is not going to be mailed out of the country. So you're going to have to, people who live abroad are not really eligible for the reimbursement. So if a check is mailed to a United States address and you're not there to get it, it may get lost in the mail. The city will not mail checks to non-US addresses.
Right, that's fine. I don't need or want the reimbursement to be sent out of the country. I will maintain a residence. I'll be living in North Carolina, but I intend to maintain a residence in North Carolina, family, etc.
Okay,
so
that's
on.
fine.
I would be traveling back and forth, say every 4 to 6 months. So yeah, I'm not moving to Thailand. That's not my question. Yeah. So, all right. So it sounds like I would be reimbursed for the Medicare as long as the check goes
Not
to
Medicare. Oh, for the premium reimbursement.
Yes, that's what I meant.
Yeah,
yes.
yeah. Okay.
Right. But I
Yes.
wouldn't get any Medicare benefits outside of the
Right.
country, which that's
Right.
acceptable. That's not a problem. So somebody said something about suspending Medicare, but I can do that for 6 months, but as long as I don't do it more than 12 months. Could somebody talk about that?
It's a messy proposition to
All right, then
de-enroll
fine.
for Medicare.
Let's not talk about it here if it's messy. So, I can take it offline or I can research it.
Thank you.
Thank you so much. You have a wonderful day. Thank you for doing.
Thank you. And I would suggest that when you are in Thailand, you inquire about possibly getting health insurance coverage while you're there, because we can never predict what's going to happen tomorrow. So that I would leave it at that.
Thank you.
Sure. So let's go to the next slide, please.
Mary? I thought we were going to take one more. Mary, do you want to ask your question?
Mary Myers, unmute yourself and ask your question.
Sure. This sort of like an overall question, but last couple of years when I attended, something like this, there was a court case going on because the various New York State, whatever, wanted to switch to a Medicare Advantage. So is that?
That's no longer.
That's like no.
That was no longer. It was blocked by the courts, and the city abandoned that idea for now. That doesn't mean it won't emerge again. Rear its ugly head again in the future. But for now, the city's been blocked, and they had made a decision to seek savings elsewhere.
Great.
Okay, good. All right, Gil, you can continue.
Okay, let's go to the next slide, please, then. So we talked about the out-of-pocket gaps with Part B. Now we're going to look at the out-of-pocket gaps with Part A, and you can see here that the numbers are a lot larger, and this is where people get into trouble financially if they don't have some form of supplemental coverage like you have with senior care. As soon as you land in the hospital as an inpatient, you have to pay a deductible under Part A. That's $1,736 in 2026. That's your first gap. Should you need to stay in a hospital beyond 60 days, there's an additional charge of $434 a day, and beyond 90 days through 150, an additional charge of $868 a day. Days 91 through 150 are referred to as your lifetime reserve days. They can be used once and only once, and as a result of that, that is why supplemental plans either include or offer as a rider an additional 365 days of hospitalization coverage, and senior care does offer that rider. It's only a few dollars a month. Strongly recommend that everybody have it. That's your second gap, these additional days beyond day 60. The third gap is if you need to be discharged from an inpatient hospitalization into a skilled nursing facility after the first 20 days, which are covered by paying the deductible, you're subject to a $217 a day co-insurance charge. Now, another thing to understand about Part A benefits is that they're not limitless. They can be exhausted in some cases, and also you can be subject to more than one Part A deductible, depending upon how frequently you go in and out of hospitals during what are known as benefit periods. A benefit period begins the day you're first hospitalized and lasts until 60 days, 60, after your discharge. So for example, you go into the hospital on January 1st for 5 days as inpatient, you'll pay the $1,736 deductible, unless you have other supplemental insurance that covers it, which I'll discuss in a moment. You get discharged on January 6th. Everything's fine, you've paid the deductible, your costs are covered. But now you've got to go back into the hospital again on February 1st. Doesn't even have to be to the same hospital, doesn't even have to be for the same medical condition. You're still covered from having paid that initial deductible because 60 days haven't gone by since you were discharged on January 6th until when you had to be readmitted on February 1st. But now in another example, let's say it's May or June and you've got to go into the hospital again. In that case, more than 60 days have elapsed since you paid that initial deductible and having to pay another one. This illustrates and helps us segue into why it is so important to have supplemental insurance with original Medicare. So let's go to the next slide, please. So how do we cover these out-of-pocket cost gaps with original Medicare? Well, those people who don't have access to retiree health benefits like you do often buy private plans that you may have heard referred to as Medigap plans because they fill in the gap that original Medicare doesn't cover. And if they're not qualified, they don't qualify for Medicaid or other assistance, they typically have to self-insure or they purchase these private plans. And these plans can cost several $100s a month. You have a terrific benefit. It's known as senior care. And senior care functions in a way similar to private Medigap plans. And it also provides prescription drug options. Let's go to the next slide, please. So, senior care supplements original Medicare, and it is a combination of Anthem, Blue Cross Blue Shield, which takes care of your Part A out-of-pocket costs, and GHI Emblem, which supplements Part B out-of-pocket costs. Now, let's talk about those cost gaps that I showed you in the last few slides. GHI Senior Care does not cover the $283 Part B deductible, so you are responsible for that. And in addition, it has its own $50 deductible that you have to meet. Once those deductibles are met, GHI Senior Care covers the 20% that Medicare doesn't cover. Medicare pays 80%, Senior Care covers the other 20%. If you need to go into a hospital, I showed you all those costs with the deductible and the additional days. With the Senior Care benefit, you have a $300 deductible per inpatient stay, and then they take care of the balance of the costs. If you have multiple hospital admissions during the year, Senior Care caps your out-of-pocket exposure for the year at $750. Senior Care also offers a low-cost rider that adds the additional 365 days of hospital coverage, which is very, very important. Now, Senior Care does not cover those Part B excess charges that can be up to 15% if you see a non-participating provider. So sometimes after you've met your deductibles, you'll get your Medicare summary notice and it'll say Medicare covered this. And then you'll get a statement from Emblem that says your Senior Care covered this, and there still may be an outstanding charge. That would typically happen because you saw a non-participating provider. For those people who are concerned about how do you avoid seeing a non-participating provider, you can look up all providers on the Medicare website at medicare.gov. You can call 1-800-Medicare, or you can call the individual provider's office and ask them if they are a participating provider that accepts assignment. Now, as of January 2025, Senior Care added $15 copays for many Part B services, so you need to be aware of that as well. And for more information about Senior Care, we've provided the Office of Labor Relations website. Are there any questions about out-of-pocket costs under Original Medicare and coverage by Senior Care?
Hi, is it still GHI Senior Care? Recently, our insurance changed from GHI to NYCE. Is that the same thing?
NYCE is for active employees and retirees under the age of 65. Once you turn 65 and you're retired, then you go on the Senior Care plan. It's not the same plan. So the plan changed for active employees, but the retiree plan did not change.
I was told by my HR department that because I'm retiring after the age of 70, that I do not go on to the senior care plan, but that I stay on Emblem GHI. Is that, and they would be my secondary? Is that true?
No.
Great.
Your health and your retiree, the retiree plan is the senior care plan because it's coordinated with Medicare. The active plan is not coordinated with Medicare. You can email me offline if you'd like.
I'm sorry, I should email you, yeah.
You can email me offline, yeah.
Because she said I was over 70, I didn't have to go on to that other plan, or the senior care plan.
That doesn't make sense to me. There must be some kind of miscommunication going on. I'll clear that up.
Okay, thank you. I appreciate it.
Okay, all right. Any other questions?
Yeah, there's one from ZV. Unmute yourself.
Hello, can you hear me?
Yes.
Yes.
Can you hear me?
Yes.
Yeah.
So I just went to HR yesterday at my school, and I'm applying for Travia for the fall. And so in filling out preliminarily the retirement medical form, the HR rep said, "Oh, you should get GHI Anthem Senior Care, that box. There are 4 boxes too that apply to me." And said, "Oh, only some people get GHI HMO Medicare Senior Supplement." So is that the supplemental one that was just being discussed that I probably should get?
The GHI senior care plan, yeah. It consists of GHI that covers the doctor portion and Anthem covers the hospital portion. But that hasn't changed. That's the same. So it's the GHI senior care plan that we've been talking about mostly.
Right, but in this form that I'm staring at, a CUNY form that I'm staring at right now, there are 4 boxes for under a heading of Medicare supplemental plans. One is DC 37, one is Anthem Medicare related coverage, and the 3rd and 4th check boxes, they said, HR said, are the ones that apply to me, and one of them is GHI/Anthem Senior Care. That's the one you've been talking about.
Right.
But the 4th one, which is what I'm interested in, that they sort of suggested I didn't need, but now I'm thinking maybe this is that, gap coverage. It's called in the form, the CUNY form, GHI HMO Medicare Senior Supplement, and then it says in parentheses, certain New York State counties only, but apparently it applies to New York City. Are you familiar with?
Yeah, I believe.
Right, so that would limit you, if you're not going to stay in the New York area, that would limit you to their network. But the GHI senior care covers all doctors who accept Medicare.
Yes, it's city retirees have options for Medicare coverage, and I think what you're referring to is one of the managed care options. But because senior care acts like a supplemental plan that the public pays several $100s a month for, it gives you the benefit of being able to use original Medicare, where you have the greatest flexibility in terms of seeing providers all over the country without any networks or without any pre-authorization process, and with a supplemental plan that is essentially premium free, except for riders and drug coverage.
The last question will be for Eric. I'm sorry.
If I want to talk private, because this concerns me a lot, since I'm retiring soon in 1 semester. So who would be a good person to call at PSC CUNY or wherever to discuss this further?
You can call me or email me.
And I don't see you on your name again is?
Talene Spengian. I'm the director of benefits. Yeah, you can email me.
Okay. Thank you very much.
All right.
Thank you.
The last question will be from
Eric.
Okay. Sorry, Aries and Mary, we're gonna have to lower your hands.
We're already over our time, but let's let Gil finish.
Let's go to the next slide, please. We're just about done. Okay, so I just want to piggyback onto something that Michael mentioned earlier. you're going to be bombarded with advertisements on television and in the mail about all these extra benefits that you could get by signing up for certain Medicare plans. Please do not. These are for the general public. You don't want to sign up for anything that is outside of your retiree benefit package because it could potentially void benefits. Just want to make you aware of it. Whether it's Joe Namath or George Foreman or Jimmy Walker or William Shatner, you're going to see a lot of celebrities pushing these plans. This is the time to take a break. These are not for you. Let's go to the next slide, please. When we talk about these extra benefits, this is just a listing of some of them. It's not an all-inclusive list, but when people start hearing about things like this, they get very excited and they want to call the 800 numbers, and that's when they get contacted and connected with health insurance agents that want to put you in a Medicare Advantage plan for the general public. I do want to mention two things that are on this slide. There is no routine eyeglass benefit with original Medicare, but they will provide one pair of eyeglasses after cataract surgery. And also, original Medicare does not cover a fully paid for comprehensive annual physical exam. Medicare does offer an annual wellness exam, not as comprehensive as a fully comprehensive exam. There may be additional charges if certain other services are required that would subject you to the deductible and to coinsurance. Let's go to the next slide, please. Again, can't say this enough. Don't sign up for any plan outside of your retirement benefit package. If you have any questions, first check with your HR benefits people. Next slide, please. Again, Medicare will never call you and ask you for bank information or social security number. Protect that Medicare number the same way you would protect a credit card. And Medicare will also not send representatives to your home. If somebody knocks on your door, they might be a private health insurance agent. Next slide, please. Strongly recommend you set up a Medicare.gov account online. You can track your claims in real time. You don't have to wait several months for your Medicare summary notice to come. And I recommend you do the same at the Social Security website at ssa.gov. Next slide, please. Where do you get help? Go first to your internal resources. You can go to the Medicare official website at medicare.gov or 1-800-Medicare. I have one more slide with resources. You can contact us at the HICAP at 212-AGING-NY if you're in the 5 boroughs of the city. There's an 800 number to call if you're outside the New York City limits, and a website to locate the State Health Insurance Assistance Program if you're outside New York State. We also do 90-minute seminars twice each month from the Office of the Aging where you can attend. They are free. They're webinars online. They're virtual. And we do in-person sessions as well. You can use the link that is on this slide. And that concludes the presentation for today. I want to thank you all for your attention and remind you that the best health plan is to do everything you can possibly do to just stay healthy.
Thanks, Gil. Appreciate your time and expertise. I would like to continue. We've gone over by a few minutes, and I know our friend Ravi from Social Security Administration is waiting for us. And Ravi, are you there?
I'm here, Talene. How are you?
Oh, before you start, I have to notify everyone that I am not allowed to record the Social Security presentation.